professionals. It is the same case. Okay. It is the same case with teachers. The teacher is not alone in the teaching environment. We can look at it from the bigger picture. The teacher works in an institution called the medical school. This institution has a lot of other teachers, a dean of the college, and many other officials operating at the same time. This very med school isn't operating alone too. It is part of a bigger institution related to the Ministry of Higher Education, Ministry of Health, and various hospitals and care centers, not to mention the other parties, international or local, accreditation bodies and quality assurance that work with the very same medical school. So this gives you a broader look at how the teachers are working. We will dive deep into that in the second part of our module. The teacher in the team. The objectives of this module is to focus on the skills needed for better teamwork and focus on the importance of faculty development. And we have just the brilliant teachers for this topic, starting off with Dr. Nazar Haddad. Dr. Nazar is a senior lecturer of chemical pathology and a consultant at Al-Fayha Diabetic Endocrine and Metabolic Center in Basrah. He's a member in the National Council of Accreditation of Medical Schools in Iraq. He has a certificate level from the Famer Kiel Masters in Health Professions Education, Accreditation and Assessment, and he's a member of the International Association of Medical Education. Next, we have Dr. Omar Mustafa. Dr. Omar is the Associate Global Director for Middle East and North Africa in RCP London. He's a consultant physician in diabetes and general internal medicine based at King's College Hospital in London. He's the training program director for the endocrinology and diabetes higher specialty training program. He's the co-chair of the simulation faculty at King's College Hospital, and he's a member of the RCP Specialty Advisory Committee. Reminding you about our schedule, we will start off with Dr. Nazar for 45 minutes talking about the dynamics of the team in the teaching environment. And then for your questions and answers, we will take a break at around 9 o'clock for 10 minutes, and then we will return back with Dr. Omar Mustafa talking about continuous professional development. We will close the day at around 10 o'clock with your opinions and remarks. Kind reminder about our rules. If you have any questions, kindly type them down in the chat box and I'll get to you accordingly, or else you can raise your hand, unmute yourself, and speak directly to the doctors. Make sure that you stay muted while the doctors are speaking to avoid any unnecessary noise. Writing on the screen is not allowed, please. And all the presentations and the materials will be sent to you after the session, so do not concern yourself with that for now. We will post a registration form in the chat box, so all of you must type their names and emails correctly on it, as it is important for issuing your certificates. And as always, you and your opinions are very important to us. So help us develop ourselves by submitting our feedback form. The team will post the link near the end of the session in the chat box, so keep an eye on that. And finally, follow us on our social media. The team will post our social links in the chat box frequently during the session. So make sure to follow us on all of them in order to not miss our news and updates. Thank you so much. This is it for me tonight, and back to you, Dr. Nazar.
Thank you very much, Dr. Amnia, for the introductions. Should I start my presentation?
Yes, please.
Okay.
Dr. Hilal, please co-host Dr. Nazar.
اوكي مساء الخير دكتور نزار.
مساء النور، مرحبا استاذنا العزيز، اهلا وسهلا.
You are now co-host. You can share your screen, please.
Okay. Okay, I do apologize if I start my presentation from the airport now, because the changing flight have been happened. I lastly informed of the day. Anyhow, I will start my presentation now. Did you get the PowerPoint?
Mm-hmm. Yes.
Okay. Is it now clear?
Yes.
Okay.
Clear. Go ahead.
Thank you very much for giving me this opportunity to present this topics, which I think that it's one of the important topic in medical educations or in training anyhow. I'm Dr. Nazar Haddad, consultant chemical pathology and the Department of Biochemistry, College of Medicine, or University of Basrah. First of all, I would like to ask a questions. In a healthcare setting, should we work as a teams? Well, if we answer to these questions, actually appeared from the such interest appeared from the report of Institute of Medicines, which is called "To Error is Human: Building a Safer Health Systems." So teamwork became a major focus in healthcare after this report, because this report has coined an important point that high rate of preventable medical errors, many of which are the result of dysfunctional or non-existing teamwork. So this is back to the 2001, and then many reports starting to address this issue. So there is a missing of a teamwork, whether in education or in practice. But before we go into the teamwork and how it's applied, let's differentiate between two important terms. First, the team or groups, because sometimes it is not used it is not interchangeable terms. For group, people are connected by shared activity or interest, may not share a common goals. They have a specific role and duty that is not assigned to individuals. This term is called a group. On the other hand, team, person associated together in work or any activities. Most important thing, they are share common goals and they have a specific task assigned to each individual. So from this definition of team, there are two important characteristics for a team. A meaningful task interdependency. We said that it is interdependency, so that the job cannot be done by a single individual. Second, the task relevant knowledge is distributed among the team members. Regarding the team competence, each team should have the following competence. First of all, it is the knowledge-based competency, which we meant by it, what team member know. It refers to the necessity of understanding fact, concept, relations, and underlying foundations of information that the team member must have to perform the task. The skill-based competency, on the other hand, it means what a team member do, and it refers to the necessary behavioral sequences or procedure need to perform the task. And finally, attitude-based competency, which refers to the effective competence needed to perform the task, and the team is greatly affected by how team members feel about one another and the task. And this is very crucial elements in creating any teams, whether for teaching or whether for training. And the teamwork in our settings is lie in two different categories. The first one is the healthcare teamwork. The second one is the teamwork that's happened in medical educations. In healthcare, there are different types of teams that we found. We may have found the project teams, example, quality improvement. Care delivery teams, this is the common one that we face in practice, such as which can be categorized further into according to the patient that have been dealt with, or according to the patient population, according to the disease type, for example, stroke teams, or care delivery settings, where this team will be work in the operating rooms or in the ICUs. And finally, the management teams. So these are the teams that we may face in healthcare practice or clinical practice. Collaborations is the most important issues among health professions. Independent parallel practice, we may find that the team may run in two ways. It is either independent parallel practice, where the team work in parallel to one another, and in that case, direct communications is minimal, is linked by one physician. On the other hand, and what we are looking for is interdisciplinary teams, where the work is together closely and they communicate freely to optimize the care of the patient. In this interdisciplinary team category, each member of the team contribute his knowledge and the skills set to augment and support the other contributions. Am I clear now?
Yes, you are clear, Nazar.
In medical educations, let's take this scenarios. For example, for a first year medical student, we have a cardiologist, pulmonologist, and psychologist, physiologist, and anatomist. And we have a course of shortness of breath, for example. The course is delivered as a 1 week of anatomy, 3 weeks of cardiology or cardiovascular cases, basic pulmonology, and 2 weeks of symptom perceptions and anxiety. So the question is, do you think that this arrangement will work as a team? And what do you think that the team is missing? If we look to the structures, we see that there is no linkage or minimal linkage between the different steps in the course. So for the team above to be integrated, to reflect the real clinical practice, they require the team to go beyond their disciplinary boundaries. Because if we return to the previous slide, we see that the anatomy given in 1 week, and then the complete separation from the cardiovasculars, then the basic pulmonology, and then the psychiatrist. But what we are required for the full integrated pattern, to have a member team to go beyond their disciplinary boundaries and explore the other expertise which make them feel uncomfortable. So in medical educations, team-based teaching method may lie in different way or may be presented in different ways. First one is a problem-based learning. Another form may be team-based learning. And there is what is called interprofessional educations. As all of you know, problem-based learning is one of the typical examples where teamwork can be worked. Problem-based learning is done in a small group format and offer a means of integrating theory with a clinical component and demands knowledge acquisitions, attitudinal and psychometric skills from its learner. The need for a motivated and educational faculty learn the new tool of the team training. There is a need of the administrative support of the educational and the clinical institution involved in the change. But problem-based learning not all the time run smoothly, and there is some enabler or hinders of the process. The most common enabler is that the teacher alignment with the institutional education philosophy. This is a very important. Teachers believe in the institutional education philosophy for a successful application of that. The most important things here is a shared team leadership. There is no single leadership. It is a shared team leadership for the successful applications and the presentations of the problem-based learning. In addition, the involvement of the organization and its support is very important. But the main hinders of this process is the barriers between different disciplines that we may face between different disciplines, whether from basic science, from clinical science, or even between the clinical sciences themselves or the basic sciences themselves. And lack of a shared course visuals is another point that may render the usefulness of problem-based learning. If we flip the rules, the team-based learning as a terms raised here. In team-based methods, here there are single instructors, but the team is played in between the students themselves. A team-based method allows single instructor to teach by conducting multiple small groups simultaneously in the same classroom. So it's applicable if you have a large number of students where problem-based learning is difficult to be applied. The learner must actively participate in and out of the class throughout preparation and group discussions. Here in team-based learning, the class time is shifted away from the learning of fact. So no more giving a fact directly, but it converted toward the applications and the integration of that information. Actually, the typical team-based learning run in 6 steps. It requires many application preparations from the side of the instructors, and there is different rules for the student to be presented. The first steps here is the pre-class preparations, where all the materials sent to the student to be prepared before coming to the class. Then, in a matter of the, for example, multiple choice questions, the individual preparations for the class being tested by what is called individual readiness assurance test, or the IRAT. We term it IRAT. After they finish that test, which is given for a certain period of time, they shifted to work in a teams where the same assessment that has happened in the IRAT will be repeated in a team form format, and the assessment will be presented in a team work. So they answer the same question that they answered in the individual manner, but through their discussions of the team. After that, there is an immediate feedback and clarification of the answer to the questions. So at this level, each individual, they will gain the knowledge and they gain the benefit of informations or gain benefit of understanding from team discussions. This is being followed by the clinical problem solving activities. And these steps, which is the final steps, the near final step, the platform will be opened through a clinical scenario and with an open case questions to the every teams of the student to share their ideas and discuss what they found in the presence of the facilitator or instructors. So here the communications and the sharing of knowledge between different teams will be happening. Finally, the final steps of the closing ceremony for the team-based learning will be happened with a peer feedback. And this is very interesting. Actually, we practiced that in for my student, and they found that this is very interesting, where every members in the team were going to evaluate and give assessment to his or her colleague, and how they have been work or reflect their work during the teams. And this is very interesting behaviors that encourage the team members to evaluate each other. So the benefit of team-based learning, it emphasizes the importance of individual and group accountability and the need and the opportunity for group interactions and the motivations to engage in give and take discussions. It increases the student engagement and higher quality of communication process. The third types that may be present is interprofessional educations. Here we should take a look at the terms. It is an interprofessional educations. It is not an interdisciplinary education. It's a little bit different, which occur when two or more professions learn with, from, and about each other in order to improve collaborations and the quality of a practice. The interprofessional education helps students to look at the task from their perspective and from the perspective of other professions as well. It enables the student to acquire the knowledge, skills, and attitude that would not acquire in a uniprofessional education. And this is very important. They acquire something that they are not exposed to in their professions. And one of the examples that have been done in the Mayo Clinic College of Medicine, they bring together the first year medical student and the first year physical therapy student. Bring them in a single class, and the student from the interprofessional educations, or what is the proper time to address introductions of that type of educations. The conventional viewpoint said that interprofessional educations is most effective when introduced to professionals who have a clear sense of their own and professional identity and have the experience to be shared. This is the classical viewpoint, but there is an opposite viewpoint, and it has been recognized through different studies that the interprofessional education should be introduced at a very early start of the professional education, to prevent the formation of what is called the negative interprofessional attitude that will be later resistant to change. So there is many literature have been forced toward early exposure of the student to enter professional education, or even to interdisciplinary education, to gain more benefits from these maneuvers. So to summarize, the teamwork is regarded as most important elements in or interest in this nowadays, and it in both in clinical practice and in teaching. And in teaching, there are different ways of introductions of teamwork, whether through a problem-based learning and through teamwork or interprofessional education. And thank you very much for your listen. Hello?
Thank you so much, Dr. Nazar. But I think when you reached the slide on the Mayo Clinic, your voice disappeared a bit. I didn't understand it. Can you just repeat it back? Yes, I didn't understand what Mayo Clinic has done.
Mayo Clinic, what the Mayo Clinic College of Medicine do, they take the first year medical student and they group medical student from first year medical student with first year physical therapy student. Okay, and the student from both programs recognize the importance of teamwork across each discipline. So they share knowledge, they share their skills, their labs, and their anatomy and understandings, and get the benefits from each group of from each others, from each professions. This is what the Mayo Clinic do, and there is many examples of that can be done, even in our locality. For example, joining the nurse with the pharmacist or with the physicians to discuss the medical or some aspect in medicines or some cases in medicines where they can benefit from such classes.
Thank you so much. Teamwork is really an important topic to be stressed on. Thank you so much for the presentation. Everyone, if you have any question or comment, you can raise your hand and unmute yourself and speak directly to Dr. Nazar.
شكرا دكتور نزار على nice and insightful presentation. It's Faiz Tuma. You made the distinction between teams and groups very clear. I really like that. I think we in medical education use group learning more than team learning. And here I got the,
Yes.
yeah, the team, as you described, is group of people who have different roles. So in medical education, occasionally use that in trauma training and or surgery training, critical care training. For example, in trauma training, you would have a nurse, a physiotherapist, a respiratory therapist, an emergency physician, and a surgeon. So that's people who have, every one of them have different roles, and they kind of collaborate to execute the task or management of critical care patient. The same thing in the operating room, where you could have a surgeon, a scrub nurse, anesthetist, and when you train the group to collaborate to perform or execute surgery, that's where you have different people working together and helping each other to view the perspective of the care from different angles. And that's what you referred to and nicely. Group learning usually is kind of group of students or residents that's kind of learning, helping each other, and that's what we use commonly, and that's a group learning, not really a team learning. So that's a clear distinction we need to keep in mind, and you made it clear here. I think we learn from each other very much by sharing other knowledge and skills of learning and perspectives. Thank you. I'm sorry I did not raise my hand. I was trying to find where the button to use that, and I did not hear anybody contributing. Thank you again for the nice, insightful review.
Thank you very much.
Thank you so much, Dr. Faiz. It's so nice to see you again. Dr. Hilal, please go ahead.
Thank you very much, and most welcome with our dear colleagues from everywhere. مساء الخير دكتور فايز، وجودك ويانا إضافة للسيشن. Nazar, excellent, and really it was very enjoyable, and thank for your time in spite of your traveling and you are at the airport, but we did a great job, better than me doing here from Baghdad. My point is that, Nazar, you raise a very important point. It's about the team-based learning. You know, the main issue of delivering messages and learning is that interactive. And one of the main obstacles and challenges for interactive learning at our colleges of medicine is that the large number of medical students accepted every year. And that one of the excuses from many faculty members is about, I cannot use the technique of active learning because of large number of students. I couldn't apply the smaller group teaching or the problem-based learning because of that. And therefore, you highlighted a very important issue, which is that using another technique of an interactive learning, using many modern methodology for learning in the team-based learning technique. And is that making use of peer learning, because the group will work together and learn from each other. And it will be an interactive, it's including multiple instructional methodology, including doing quizzes initially alone, and then as a group, and then having a feedback technique, and then have evaluation of everyone to his peers. So I think this is a great chance for us to keep with the modern instructional methodology by using the team-based learning. Thank you, Nazar, for raising that point.
Thank you very much. Thank you very much for your comment, and I really appreciate your feedback. This is actually, I practice team-based learning in this classical maneuver, and this is that is guided by I think by one of the AMI guidelines through these steps for 2 years. Last year I practiced it with 800 students, and this year is with 600 students, which is divided into three separate large halls, around 250 in each hall. Really, if you have the commitment to do the team-based learning, and it can be done. The number is not an obstacle, and the student will love that. The student in one of the they stay for beyond the time of the end of the class. They want to gain more and more from this peer or this activity sharing. And when the team are joined, they discuss the informations, they learn from each other. They discover a wonderful point, and they try, each team try to convince the one another. So I urge every teachers to practice that. I know that the trials, even me, that I was hesitate at the start to do that, but I said, let's rush into that point and let's test it, and actually it's successful. I can share some photos in the groups about some of the videos of how the students do in a large halls. They're not necessarily to be all the equipment is present. Thank you very much, Dr. Hadad.
Thank you, Nazar. Just one point. I think Dr. Omni and other graduate from College of Medicine, Baghdad University. We are using another technique, interactive technique, which is called integrative learning activities.
ILA, yes.
Probably you can elaborate on that, Omnia, just for the audience, please.
Yes, so in Baghdad College of Medicine, we used to have something called integrated learning activity, which is something similar to what Dr. Nazar has said. You have a chief complaint, say shortness of breath or palpitation. You get a case published on the INALI, which is our which is the university link. We go to it and we check the case. You have the case with all the information and a couple of questions related to it. And then the tutor asks you to make a group or a team, assign a couple of people to each task, and then you go work together on that case. This is in the clinical years and the basic years, because our program used to be integrated. So some of the questions are related to basic sciences, say the coronary circulation or the anatomy of the heart, and other questions are clinical, say the presentation, palpitation, what do you think, the differential, what do you think, the main cause of the problem, how are you going to manage the patient? And then we go as a team in the large hall. You have a couple of mentors, a couple of facilitators. They imitate the session, they imitate the case to you. Some of them is a patient and the other is a doctor. And you go as a team and elaborate your answers with the facilitators. This was the best learning activity I've ever been to, and I say it again and again, because you gain confidence, communication skills, you integrate the basic and the clinical sciences together, you get a whole understanding of the subject. ولحد الآن دكتور أتذكر الILA اللي حضرته عن الفالفولار ديزيز وعن الانفكشس ديزيزز كان على أيضا كارديولوجي، ولحد الآن يعني إحنا بهذه المادة ما ننساها بسبب التيم ورك اللي صار اكو exchange of ideas. So deep learning, better understanding, highly recommended activity.
Yes, very nice.
Thank you. Thank you, Omni.
Okay, so we have Dr. Mariam raising her hand. Dr. Mariam, please go ahead.
Thank you, Omnia. Thank you, Dr. Nazar, for the clear presentation and wish you a safe flight. Can you please elaborate more on individual and team readiness assurance tests?
Yes, for team, for individual readiness assurance test, it is type of multiple choice questions. As you know, in team-based learning, the student took all the materials and studied them day before or period before. And then when he come to the team-based sessions, there was a 10 minutes of multiple choice questions on certain elements or certain knowledge within the material that had been studied. So each person in the hall, a lecture hall as whole, test or examine himself individually. So this is the first steps. And then he closed that papers and put it aside. The next steps is the repeat of what have been given previously of the questions. But here the group will play the role. يجي الفريق come together and discuss how to answer that questions. They found themselves, some of them found themselves answer wrong, some of them have changed their ideas, and the discussions between the groups to answer a specific MCQ or specific multiple choice will lead them to explain many of the ideas to each other. So at this stage, they answer the questions in a group rather than individually. And finally, they come to to score their numbers. So it is interesting that the students score themselves. Nobody score them. When they hear, they put for themselves either 2, 1, or 0, whatever the remark is. And this is an interesting practice. They love it to give themselves the mark rather than the teacher to give them the mark, according to the true answer that is appear on the screen. So they know what is the differences, and each individuals in the group in that case know where is his defect or where is his deficiency in the knowledge. So this is the way how they test their knowledge. And then finally, if they have some of the point to be clarified in the clarification sessions. I hope this is clear for you.
Thank you.
Thank you.
Thank you so much. So I think we have another question from Dr. Basim, and I will add to his question. So I'm working now as a junior teaching assistant in Baghdad University College of Medicine, teaching anatomy to first and second year students.
Mm-hmm.
So I've incorporated this TBL, the team-based learning, but the problem is the limited time. So you said that at the end of the session, we should do something called feedback and debriefing for the participants. When I tried this in real life, I didn't have the proper time to do the feedback and debriefing. So any tips on doing that and incorporating it into the real practice? Because we have a huge number of students and limited time. So how can we solve this thing? Okay, العفو دكتور نزار بس سمعت السؤال.
Yes. So he didn't have a time for to do evaluations.
Yes, feedback and debriefing
Yes,
after
feedback.
yes.
After what? Feedback after what?
After the TBL.
The final steps is the evaluations of each student to their colleague. So this feedback is between them rather than the evaluation from the instructors, because this feedback, the values of this feedback or evaluations between each other is to make the point about the team or the role played by each individual. So this is to diagnose which person is less active in that teams and which person is the most active, and each person will have will be in a situation that he should be engaged in the teams, otherwise his mark will be low. An actual or in a classical team-based learning, every steps in the team-based learning is being given a certain mark, and although it's totally formative activities, but every part have been given a mark. So this is the phase. I recommend if you can give them an individual paper or a small paper and let them allow each team to evaluate themselves between them, rather than each instructor evaluate the team. So in this way, each individuals will know that. If you want to evaluate the team performance, this will happen in the application practice, not in the final steps. Hope
Okay, thank you
I
so
have a clear point.
Yes, thank you so much. We have Dr. Nasir. Dr. Nasir is the Dean of Wasat University. Most welcome, Dr. Nasir. Nice seeing you again.
السلام عليكم. السلام
عليكم
عليكم.
السلام.
عاش سيدك دكتور نزار، المحاضرة الرائعة، الكونسايز بريسايز هايلي بيرفورمينج. حقيقة اكو فد مسألة الدكتورة أمنية، اعتقد احنا هاي يعني شوية نسوي فد هايبريد بين الرياليتي وبين الالكترونيك اليمنت. نقدر انه نلاحظ انه يعني at the end يسوي لي فد فيدباك على اذا عندنا فد كلاس روم، عندنا فد كونتاكت من ذن الالكترونيك كونتاكت. فوراها انت على راحتك شو وقت ما تريدين تاخذين الاليمنت مال الفيدباك مالتهم كلهم. اذا انت فور يعني ايفالويشن البرفورمانس مالتهم خلال المنطقه، ومو فور يعني از فورماتيف نوت از سماتيف. فهاي وحده من التريكس اللي نعالج بها هاي اللارج جروب education. اكو دكتور نزار احنا حقيقه تطبيق، اكو تطبيق بسيط هو انت يعني اشرت له يمكن في جزء من عنده. ذول الماتشور ستودنت يعني الجريد 5 4 6 فالتقسيمات بسيطه، نقسم 2 جروب و2 جروب ماني سمول جروب، يصيرون فريقين كانما، وكل فريق على احنا متفقين ماخذين فد يعني خلينا نقول مثال مثلا بالجي اي تي ماخذين الانفلاماتوري باول، ماخذين الجي اي تي اونكولوجي، نقول كل جروب من عندهم راح يسوون لنا فد مجموعه اسئله للجروب المناظر لهم، ونعطيهم فد وقت معين يعني يسوون الاسئله creation the questions. ذولاك هم نفس يتبادلون بالاسئله، وراها نحقق كل جروب يا هو راح يكون يرجعون يصححون، يعني فيصير فد بير ريفيو بير education فد very nice، خاصة إذا teacher oriented وين يريد ويهذب يعني شلون نقول يعزز هاي الأسئلة بالمين اوبجكت مال الليكتشرز مالته. فهاي حقيقة من الممارسات شفتها رائعة، وشفتها يعني يعني شلون نقول الاكتيف ليرنينج يكون بها تفاعل شديد. وشكرا جزيلا.
شكرا لك دكتور.
شكرا جزيلا دكتور نصير. Okay, anyone, if you have any question or comment, you can, yes, Dr. Mustafa Sharifi, please go ahead.
Okay. Thank you so much, Dr. Nazar. I am Mustafa, a fifth-year medical student from the University of Baghdad and an aspiring future medical educator. I just wanted to ask about one of the topics that you discussed, which is interprofessional education and collaborative practice, since it's a critical topic for postgraduates when they're put into the heart of the experience once they graduate and they are part of team, but didn't have prior knowledge on how to act within the roles of that team, whether it's doctors, pharmacists, and any other aspects of the medical staff. So I wanted to ask for you and everyone here who has an experience in the topic, since we have some stakeholders who play a role in the building of our education system, about what do you think about the readiness of our system to adopt this approach, and what are the best practices on how we can implement it?
Okay, شكرا لك دكتور نزيز. بس I think that part, if it is want to be done, it should be done in an elective program at first, then to be introduced as part of the clinical or part of the curriculum. So I suggest if it can be an elective. But I want to raise some point here that when the Akuchan, let me speak in Arabic يعني شوي على الموضوع المقررات، مرات تصير مقررات. نظام المقررات اللي راد يصير في الفقرة انه يحول أنظمة الجامعات إلى مقررات. بنظام المقررات أكو ما يسمى الانتربروفيشنال education. يعني يجي طالب من كلية الطب يقعد مع طالب من كلية الصيدلة، يقعد مع طالب من كلية ياخذون جروب واحد أو سيشن واحد. فهاي يعني مطبقة، مو ما مطبقة، موجودة أصلا. يعني كانت حتى في جامعة البصرة، لأن هي الجامعة الوحيدة اللي مطبقة كانت نظام مقررات في إحدى كلياتها. يعني. فيعني هاي موجودة. فال يعني تحقيقها مو صعب بل سهل، بس تبقى الاتيتيود مال ال different student, the levels of knowledge and how can deal, this all should be arranged. يعني ما تترك للصدفة انهم in precise way حتى لا يصير خلينا نقول ردة فعل من او negative point about different professions. يعني احنا نريد collaborations rather than a negative point مال each professions. والتايمينج لها جدا مناسب. كل الستاديز هسه تقول انه the best times to be introduced in the first years، لانهم بعدهم ما ماخذين النظره على البروفيشنز مالتهم. although اكو ستاديز تقول لك الستودنت من يطلع من come from the secondary schools to the college, they are very well aware of their professions, but that's dissolved in the first years of the practice or engagement in the college. فهاي اللي المعرفة اللي عندي على موضوع الانتربروفيشنالز، فهو ممكن تحقيقه. يعني أعتقد إحنا عندنا هواية shared between different professions.
Thank you so much. Dr. Faiz, please go ahead.
Thank you again for reviewing such an important topic. The concepts of feedback and teaching and evaluation are overlapping. So when a group, one of the students, let's say, does something not right or wrong, or say something not right or wrong, and you correct them as a teacher, would that be considered a feedback or teaching? It's more likely teaching than feedback, even though it resulted after an action or an input from the student. The same thing for the evaluation. If at the end of a session, you tell the students, you've done great in that topic, but probably you could improve on the management part of the topic. Is that a feedback or this is evaluation? There's some confusion about it too, but it's okay to kind of use them interchangeably to a certain degree. And generally, feedback is used after a performance of a task. And that's when you can see the whole performance. When, let's say, you're addressing the bleeding part of the patient was prompt and adequate, but you hesitated in initiating the first measures of dealing with the resuscitation, then you were able to catch up and save the patient by getting prompt measures. And usually is more applicable in the pattern of behavior when you see things over a period of time or repeated, let's say, mistakes or level of performance. You would say, for the student, for example, you're not paying attention to the minor details, or you're not prioritizing your points of action. That comes after a period of observation, and then you can give a feedback. And generally, feedback has a bit more elements than just telling the student what went right, what went wrong. Feedback has probably few elements. If we can summarize feedback, it would start with observation of the performance in patterns, repeated actions, then evaluating this action or behavior, then sharing that observation and evaluation with the student. That's what we call kind of telling the students, and then proposing the plan of action of how to correct or improve that performance, then helping out the student to reach to that goal, that level. That will be kind of the perfect feedback. I know it's not possible at all times and probably not all actions. So kind of a session of a group discussion, it's not really where a feedback would be given, probably intervention with teaching moments and guidance moments and overall evaluation of the performance. That would be what could be done and what could be useful. Thank you.
Thank you so much, Dr. Faiz. Always brilliant remarks. So everyone, we still have 3 more minutes if you need to add something. Okay, so I think we just go directly to the break. Yes, Dr. Nazar, you want to add something? All right, everyone, thank you so much for attending tonight's session. Thank you so much, Dr. Nazar. Hope you a nice and safe flight. Everyone, we would go back now to a break for 10 minutes, and then we will continue with Dr. Omar Mustafa. See you after 10 minutes.